Hey there, and happy International Flat Week. I'm recording this on Flat Day, but this video will come out the day after International Flat Day. I'm celebrating today with my flat sisters in my area, and so I'm wearing my half shirt that shows off my tattoo. I love this shirt. I need to wear it more often. But today I'm talking about something totally different than flat. I'm talking about nerve pain after mastectomy and lumpectomy. Everyone asks me about this in my videos, especially when I talk about scars and healing. I get lots of questions about this, and I have to say I'm not the expert. I'm just a nutritionist and a patient and a breast cancer advocate that's done some research on nerve pain. The reason I did my research on nerve pain after mastectomy and lumpectomy is that pain was the thing that I feared the most going into this surgery, my first mastectomy. I was at first going to get a lumpectomy, and I decided at the last minute to get a mastectomy for two reasons. One of my surgeons that I had gone to for a second opinion told me that she felt that mastectomies had less chance of nerve pain after the surgery than lumpectomies did, and that surprised me because no one had told me that. And I'm not sure if that's accurate or not. I don't know. I haven't looked at the data on that, so don't quote me on that. But the other reason was that another oncologist that I saw, an integrative MD that I saw, who is a medical oncologist down in Ashland, who I still really look up to and love her work and her research. And she has a podcast called Docs Talk Shop that you should check out. Anyway, she told me in my consultation with her that it was likely that I had invasive cancer, and if I didn't get a mastectomy, I might miss it. And she was right. I did have invasive cancer. I went in thinking I only had precancer or DCIS. That was the only thing I was diagnosed with. And after my mastectomy, I came out with a diagnosis of actual invasive cancer, which is real cancer, not precancer. So I was really glad I got a mastectomy for both of those reasons. But I wanted to share some of the research that I've done, both for my own preparation 2 years ago before my mastectomy and more recently with the help of American Cancer Society. If you're looking for data and definitions, American Cancer Society is one of the best places to go to. I always love the Mayo Clinic for general medical information, but American Cancer Society is the authority on cancer. So I'm using their statistics and their information in my video today, and I will link to their page on postmastectomy pain syndrome in the show notes of this video as well. So postmastectomy pain syndrome is the name that we give this nerve condition of damaged nerves after mastectomy or lumpectomy. It's not just after mastectomy. It happens with mastectomy and lumpectomy. And it especially happens with those of us who have had a full axillary lymph node dissection, which means we've had all of the lymph nodes removed. And it sometimes happens for those who have had just a few lymph nodes removed, like myself. Now, different surgeons have different techniques to avoid nerve damage. And this is where it gets really interesting in my research and in my conversations with different breast cancer patients. So, for example, in my recent podcast episode, my podcast is called A Breast Cancer Diary, if you haven't heard of it. My interview with Avina Ward, one of the parts of our conversation that didn't make it in the cutting room, but an interesting part of our conversation was that her surgeon told her that after many decades of doing breast surgeries, I think she said she was one of his last patients. He had gone like 40 years or something doing breast surgeries, only breast surgeries, and had never had any of his patients complain of lymphedema, which is another outcome. It's a swelling of the arm and the armpit and the entire arm that happens after lymph node dissection. And he said he had never had that happen because he knew how to take the lymph nodes out without damaging the nerves. Well, if he knew that, why isn't he teaching all the rest of the surgeons around the world not to do that? Because women are suffering from this. And so that was kind of shocking to me. But I had a similar experience. When I showed up in my first consult in Seattle with my second mastectomy breast surgeon, I went to her for the aesthetic qualities of her breast outcomes. So I was going to her for a beautiful Goldilocks, and I got a beautiful Goldilocks. That's this side. And I was very happy with my outcome, but it just so happens that a lot of her patients go to her because she was specially trained to have nerve preservation techniques in her surgical technique. So she had another thing on her list of offerings that I wasn't even looking for, that I learned about after I met her. And she said that a lot of her clients or patients come to her because they want no nerve damage after mastectomy. Well, yeah, if we knew to ask for that, most of us would definitely ask for that. But it's kind of a new thing, and only a few surgeons have that specialization or that training. And so I'm happy to say that while I did have quite a bit of numbness in my first mastectomy side, after 2 years, I have almost full sensation. The scars themselves are a little bit desensitized still, but when I tap anywhere on this side of my chest, I have sensation. So after 2 years, I do have a pretty well reestablished nerve growth and nerve sensitivity. But on this side, I never really had much numbness. The side where I had the surgeon that was specially trained for nerve preservation, I never had much numbness at all, and I never had much pain. I didn't have pain on either side, honestly, because I took gabapentin afterward, and I think gabapentin is definitely the drug to go to if you're worried about nerve pain. Now, I'm not a fan of pharmaceuticals. I do as few pharmaceutical doses as I can in any given situation. But gabapentin is a drug that I am very fond of because I've read studies that it really does help with long-term pain control. So it really prevents long-term pain after lumpectomy or mastectomy. And I'm going to quote the study that I went to for that information. It's a very detailed study. It's available online, and the protocol is available in the study. The protocol that I used, I took preemptive gabapentin doses as well as topical amla cream. And that's what this study was using as its the study arm of the study. So, and it does claim that there was quite a bit of reduction of long-term pain. And so preemptively, and of course after surgery as well, doses of gabapentin and application of amlacrene on the chest, not on the incisions, but on the chest in the general area of the surgery is what the protocol calls for. And maybe that is why I don't have any long-term pain, or maybe it's the skill of my surgeons. It could be either one, and there's no way to tell. I have never had swelling either, and I understand the mechanism of swelling is misunderstood to be related to salt intake, when really it is mostly related to sugar intake. And so I believe that's the reason I never had any swelling with either mastectomy or my revision surgery. I've had 3 breast surgeries in total and never any swelling at all. And I've had, for years, no sugar in my diet, so that's no mystery to me. It's not a surprise that I ended up with no swelling. If I had had more lymph nodes taken out, I only had a couple lymph nodes taken out, but if I had had more lymph nodes taken out, then I would have had swelling, most probably not because of my diet, but because of the lymphedema risk. And I think that the tides are really turning. I went to San Antonio last year, and I'll be going to San Antonio this year. I just got my flights. San Antonio Breast Cancer Symposium is the world's largest gathering place of researchers around breast cancer science. And that's where the biggest kind of developments and discoveries are unveiled every year. It's really exciting. And they're making it more layperson friendly because more and more advocates such as myself are showing up every year, and the researchers want to include us in teaching what they've learned. And so it is a little bit more understandable to in some settings, not in every. In the drug study reports and presentations, it's a little bit more over my head than in like the lymph node dissection studies and presentations. Anyway, last year in December at San Antonio, the biggest unveiling and the biggest amount of conversations and presentations were about this new tide changing in terms of axillary lymph node dissection and whether it's really worth it with all the pain and all the swelling and lifelong lymphedema symptoms that women have. Is it really worth it? Now, radiation can also influence pain and swelling, and radiation is the alternative to axillary lymph node dissection. So you're looking at 2 things that are potentially going to cause long-term swelling and pain anyway. But it is being found that radiation is less harmful overall, especially with those who need a full lymph node dissection. And so surgeons all over the world are changing their practices in this area, and there are less and less lymph node dissections happening because of that. But I'm going to read to you the full list of symptoms and causes of this post-mastectomy pain syndrome from the American Cancer Society. So it's caused because of damage to nerves, mostly in the upper quadrant and outer quadrant of the breast and near the armpit. So the pain and the nerves, they're there because the nerves are there, but also because the lymph nodes are there. So it's kind of a whole holistic kind of picture. And damage to the nerves is what's causing the stiffness, pain, and swelling. And then the more lymph nodes you had taken out, the more risk there is of stiffness, pain, and swelling. And treatment with radiation can also exacerbate this condition. Overweight women are the one factor that is seen as preventable ahead of time. So overweight as a quality going into surgery is definitely going to count against you. And we don't know why. It's probably something to do with inflammation that comes with overweight. And strangely, the other population that's identified as being at risk coming into surgery is women with anxiety and depression. And that we have no idea why that is. It could be because of the drugs that they're on. It could be just because of the inflammation, the brain inflammation, systemic inflammation that they're experiencing as a result of that anxiety and depression. It could be other things that we haven't even thought of yet. So we don't know why, what the mechanism of that risk factor is. In either case, either obesity and overweight or the anxiety and depression. We just know that they're correlated. The treatment for this condition, as I said, and the one that I used was gabapentin. It is probably the best. It is a nerve pain only kind of drug. It also helps with sleep and some menopause symptoms, but it's mainly used for nerve pain prevention. And it doesn't work for everyone. And for some women, it gives really crazy symptoms. So it's not for everyone. My mother-in-law took it. She couldn't stand it for even a couple of days. She was on a pretty high dose, but it really messes with your emotions in some cases, in some doses. For me, it didn't mess with my emotions at all. For some women, it really makes you drowsy and makes you sleep. For me, it actually, I think, hurt my sleep. It didn't make me sleepy at all. So it really interacts with your personal chemistry differently, and probably different drugs that you might be taking as well. We all just don't know what all the different drug interactions are. There's no way to predict them, and they're not being studied very well, so there's no way to tell that. But if you're willing to try gabapentin at lower doses, I think it's a really good nerve pain preventative medicine. In my case, it seems to have been helpful. Now, one thing I will say about gabapentin is that you need to ramp up and ramp back down very slowly and incrementally. Your doctor may not know this, but probably they do, and your pharmacist certainly does. You don't want to go onto a big high dose of gabapentin suddenly. You want to go very slowly up 100 milligrams at a time usually. So again, I'm not a doctor, I'm a nutritionist. I do not prescribe pharmaceuticals. I'm just telling you what my doctor told me and what I experienced as a patient. The other thing that can help with the post-mastectomy pain syndrome is actually working on your scars in a surgical sense or a laser sense. So it is usually the breaking of the nerves and the regrowth of the nerves that causes pain after mastectomy or lumpectomy. And so if your nerves have regrown in a way that is dysfunctional, that could be causing pain. And sometimes actually cutting or burning the scar or the wound in a dermatological setting could be something that might relieve pain. And so you may want to go to your dermatologist and talk to them about laser surgery after mastectomy. In some cases, it can resolve and break up those nerve endings and let them regrow in a more functional fashion. This is not something that's very normative, it's very new, but it is listed on the American Cancer Society website as a way to treat nerve pain after mastectomy. So it's a legitimate thing to look into, and you can quote the American Cancer Society, don't quote me, but quote them to your dermatologist or your breast surgeon or even your plastic surgeon if you're going to them for your pain and you have this idea that it might help you. Finally, physical therapy is a great thing, especially if you have stiffness and swelling. It's not so much for pain, but stiffness and lack of mobility, you definitely want to go to a PT and get your insurance to cover that. You are worthy of being covered for that. If you have any lack of mobility in your arm or your shoulder, around your armpit, if there's any pain or swelling that's keeping you from being mobile, you definitely don't want to stay immobile for a number of months. So go to a physical therapist that specializes in post-breast cancer surgery. You should be able to find one. I went to one that only works with breast cancer patients, and she's amazing. She's so insightful. She does massage on scars. She does a lot of physical therapy exercises and mobility measurement, and just measuring whether you're gaining flexibility over time is really, really important. So physical therapy is a potential treatment, again, not for pain, but mostly for that swelling and stiffness and for lymphedema in general. So that's kind of the extent of my knowledge and experience around pain, swelling, and stiffness after a mastectomy or lumpectomy. I'm sure that more advances will be made. This is not a big area of research because it's not an area of curing, wanting to cure cancer. That's where all the money goes. But I think there will be smaller studies coming out over time that will look at new drugs, new preventative measures, new topical treatments. Certainly CBD and THC are really good for topical treatments of any kind of pain, especially pain that's close to the surface. That's been proven already. So if you have a legal dispensary in your state, you may try topical THC combined with CBD, which heightens the pain reducing or analgesic effects. That is something I can speak to as a nutritionist. So I'll probably do more videos on these subjects individually in the future, depending on what your questions are. If I left something out or if I didn't make something clear, please let me know that in the comments below. And I'll talk to you next time. See you then.